You got to the emergency room and they gave you a number. But what that number actually means? Does it mean how long you'll wait? Does it mean how serious your condition? And why do some people get called before others? Today I'll explain what triage levels usually mean and why they matter. So when you arrive in the emergency room, one of the first steps is often triage. And I explained that in the first video, so you can check that out. So triage is just a process where they decide how urgent each patient needs are and the level of care that they need. So in that instance, a nurse may ask several different questions. So first they may ask you about your symptoms, when did they start? If you're having pain, they want to know how much your pain level is. They want to know if you're having any breathing problems, if you're in any distress, your heart rate. They look at your blood pressure, your temperature, and just your overall appearance. So they're going to look at how do you look, how do you appear to them. So they're doing this because, first of all, they need to know who gets seen first. So this is just a way to help them prioritize the care for, the number of individuals that come through their emergency department on a daily basis. So some people think it's first come, first serve, but that's not the case. And this is one of the biggest misunderstandings in the emergency department, because individuals, they think that it's based on, the time they get there. So that's not how the emergency department work. But instead, they are going to see the ones that are sicker or the sickest individuals will get seen first. So that means that, they may call somebody that came in after you. That's just how the system works. And I know that can feel frustrating, but this is really how it is designed to protect you, to protect the lives of others. So don't be frustrated, because that is the system. Many hospitals use triage levels 1 to 5. Level 1 is the most urgent, and level 5 is the least urgent. So different countries and hospitals may have slightly different system, but that is what they use, and they call that an acuity scale. So for example, level 1 is life threatening. So someone comes in, they're in immediate life-threatening emergency, and therefore they need care right away. So, for example, somebody may come in because they are not breathing. CPR is in progress. Or somebody's having a heart attack, cardiac arrest. Someone may be unconscious, not breathing. Or even someone with a severe asthma attack. They may have difficulty with their airway. Or somebody may be in shock, could be burned. There are so many things that could fit in that category. So these patients will need immediate attention. So you will see that the staff are responding right away because every second and minute matter in this situation. So level 2 is very urgent. So these patients may be seriously ill and need rapid assessment. So again, it could be somebody with chest pain. Someone may come in, they're having symptoms that, one will think is a stroke or trouble breathing again, depends on the level. And there may be having pain and there's a concern, right? So again, these patients are usually seen quickly because their condition may worsen fast. So when you go on to level 3, which is urgent, but these patients are considered stable, and they could be individuals such as those with dehydration. They're having some kind of pain, but it's not as severe. Or it could be someone with broken bones, fever. They're having pain, but it's not as severe. So these patients still need medical attention, but they may wait longer than someone who is in level 1 or 2 because their situation is considered stable. Now, when we move on to what is considered level 4, these are less urgent cases. So these could be something like minor injuries, mild infection, sprains, cuts that are not severe, symptoms that are uncomfortable, but they may seem to be at a lower risk. So these patients, of course, may safely wait longer, just depending on how busy the emergency department is. And then you go on to level 5, which is your non-urgent cases. So level 5 often means these are low acuity or low concern. So could be like rashes, somebody need a prescription filled. There's really mild symptoms without warning signs, or small issues that just need routine assessment. So this patient may wait the longest in the emergency department because their symptom is just that. This is not an emergency situation. So they can wait. They can wait a little longer. Someone comes into the emergency department after you and they get seen before you. It is usually based on medical need, not on arrival time. If their situation is more urgent, then they are going to be seen before you do. So now that gives you an overview of what your triage number means. Usually it reflects how urgently care may be needed at that moment, not how important you are as a patient. So you know that while you're waiting, if your symptom worsened, you are to let the staff know, because we know that things can change. So let them know if your symptom worsened. Did you know this information before now? Just follow for more clarification on the ER process. I'm Angie D. Thank you for watching. Please follow, please share, please subscribe for more. Thank you.